Hi, my name is Adara Sos, and my research critique was done on an article titled Managing Cardiovascular Risks with Tai Chi in People with Coronary Artery Disease. The problem is that coronary artery disease is a chronic condition that requires individuals to adopt significant lifestyle changes. Tai Chi has been introduced by healthcare professionals to promote cardiovascular health and functioning and improve quality of life. However, patient participation from those with cardiovascular problems is low. This could be due to the lack of motivation, high cost or lack of expenses, and limited accessibility to intervention programs. This problem is significant to nursing practice because the number of global CAD-related deaths are expected to rise over the next 2 decades. This might be preventable if effective interventions are applied to reduce associated risk factors for this disease. Programs for modifying cardiovascular risk factors include interventions such as smoking cessation, behavioral modification, stress management, diet, and regular exercise. These interventions alone have been proven to be beneficial in reducing cardiac morbidity, and mortality. The purpose of this study was to implement Tai Chi exercise, nutrition education, and stress management as a cardiovascular risk management program. Another purpose of this study was also to assess the effects of this program and determine if they were beneficial. The last purpose of this study was to determine whether implementing a Tai Chi exercise program alone is equally or less beneficial than implementing one with a nutrition, education, and stress management course. The study design consisted of a quasi-experimental pre-test, post-test design with a non-equivalent control group. The framework that the researchers focused on was the health promotion model. The treatment or intervention that was implemented in this study was the Tai Chi exercise with and without the nutrition, education, and stress management. The dependent variable in this study are the cardiovascular patients with coronary artery disease. The independent variable in this study is the Tai Chi program with and without the nutrition, education, and the stress management course. The sampling method used in this study was the convenience and non-random sampling method. The researchers allowed the participants to choose the intervention that best suits them. They believe that this would enhance the participation of the participants. A sample of 117 adults with CAD were included. The inclusion criteria consisted of patients with CAD and no cardiac surgery planned within the following 6 months. Exclusion criteria consisted of any previous history of an exercise program or a nutritional class. The researchers used the G-Power 3.0 to estimate the sample size. The estimated potential attrition rate was 25 to 30%. This meant that they needed about 100 participants for this particular study. The Tai Chi program was conducted once a week for 60 minutes. Tai Chi sessions were led by a certified instructor and 2 Tai Chi practitioners as well. Participants were also required to perform an at-home exercise 3 times a week for at least 30 minutes each. Nutrition classes were offered during the first week of each month, and they were 1 hour long. Stress management classes were offered during the 3rd week of each month and were also 1 hour long. Data was collected using the Cardiac Health Behavior Scale, the Short Form Health Survey, and the Korean version of SF36V2. Analysis of covariance was used to compare outcome variables with pre-test variables. Data was measured before and after the 6-month study. Scores for modifiable cardiovascular risk factors were calculated based on scores for age, family history, cholesterol, glucose, systolic blood pressure, obesity and BMI, smoking, and stress and exercise behavior. All data were analyzed using SPSS for Windows Software 15.0. This study was supported by the Chungnam National University Hospital Research Fund in 2005. Authors of this study reported that there were no conflicts of interest. This study was approved by the appropriate ethics committee. All data were encoded on and analyzed on a computer that was only accessible by the research team, and it was only accessible with a password. The study results concluded that both Tai Chi intervention programs were effective. However, the Tai Chi with Education program was more effective than the Tai Chi only program. The researchers found significant improvements in systolic blood pressure for both groups. More than half of the participants were diagnosed with hypertension in addition to CAD. Systolic blood pressure readings for both intervention groups were significantly lower at the end of the 6-month study. Participants also reported improved mental and emotional quality of life. They did not find any change in blood cholesterol levels because a more intense exercise is needed to produce these changes. One limitation of this study is that it is offered at an inconvenient time. The program took place on Sunday mornings, which was difficult for the women participants because they were expected to be home by their family members at this time. Gender role differences are another limitation to this study. Significantly more men were in the Tai Chi with Education group than in any of the other groups. Participant dropout rate was another limitation that was identified in this study. This could be linked to the cultural differences among this population and their views on gender roles. Tai Chi could be offered in combination with nutrition and stress management education as a nursing intervention. It could also manage cardiovascular risks and improve quality of life in those with CAD. In conclusion, coronary artery disease is a chronic disease that is preventable if effective interventions are applied to reduce risk factors for this disease. Tai Chi with nutritional education and stress management is proven to be an effective intervention. Tai Chi also reduces blood pressure and is one of the major risk factors for CAD. Thanks for listening.